Dr. Robert Redfield, Director of the Centers for Disease Control and Prevention, is joining us now live to give us more insight into this crisis. Dr. Redfield, good morning.
Good morning. Thanks for having me.
Thank you for being with us. The CDC, of course, is now predicting that we could reach more than 200,000 deaths within the next 3 weeks. What are the biggest factors behind the current spread of the virus, and what's the best thing people can do right now to prevent the spread?
Well, right now, the virus is spreading significantly among individuals aged 18 to 22. So it's important to realize that, obviously, and this is why it's also important as we look at individuals going back to college and universities, where we're starting to see spread of the infection. We've strongly encouraged the universities to have these individuals stay within the college setting and respond to the outbreak there, rather than have them go back and potentially see different parts of the country. The most important thing right now, though, is to remember that we have powerful weapons against this virus. We've come a long way. That's the face mask. It's social distancing. That's hand hygiene. That's being smart about crowds, particularly indoor crowds, staying away from crowded situations, particularly bars. And the most important thing, too, that we can do in September, October is to embrace the flu vaccine.
Now, Dr. Redfield, the fall school year is underway here in Metro Detroit and all over the country. And some districts are offering in-person learning. Is that the right move? And what do we know about the risk, not only to children, but that the risk children pose to the adults and to the people around them?
Very important question. First, I've gone on record that I do believe it's in the public health interest of K through 12s to get back into face-to-face learning. There's been a number of public health consequences by closing the schools, but it has to be done smartly and safely. Recognizing the risk of COVID in schools is really reflective of the risk of COVID transmission in the community. Most of the cases that you're hearing about in schools didn't actually get infected in the school. They got infected in the community. So the most important thing we can do to help keep our schools open is to control transmission of COVID in the community. Michigan's done a great job. I mean, Detroit, you were all one of the first cities that was really hit hard back in March and April. Now the state of Michigan's really got the overall positivity rate down under, I think it's around 3.2% this week. So secondly, with your question about the kids can transmit. And when some people try to suggest they think kids are less likely to transmit than adults, I don't think there's any scientific data to support that. We have an MMWR coming out this week that's going to show transmission from kids to parents. So it is important, again, to do this in a safe and smart way, particularly as we open the schools, to recognize we have to protect the vulnerable.
Dr. Redfield, Michigan Governor Gretchen Whitmer just gave gyms the green light to reopen earlier this week with mask requirements and social distancing in place. What would you say to Michiganders who are concerned about working out indoors?
Again, I think it's important to maintain the social distancing, to make sure the indoor spaces have as good ventilation. I think it's important that people do respect each other and wear masks when they're in that indoor setting. Even if they think they can maintain 6 feet social distancing, they're going to end up walking around and crossing each other. And I do want to let people know that masks really do work. I know it's hard for some people to believe that something as simple as this can be a powerful weapon against the coronavirus. It really does. And it really does help prevent the individual that happens to be infected from being able to transmit to someone else. We call it source control. It also has some impact in preventing acquisition, but its major effect is to be able to prevent what we call source control, that infected people can become less infectious when they have to do it through a mask.
All right, Dr. Redfield, what is your estimate about when a safe and effective vaccine will be available? Of course, that's going to be really key to controlling this and getting us back to normal.
It's really important. This has been one of the most aggressive vaccine development programs I've seen. I've been in vaccine development most of my professional career. As you know, it was less than 65 days from the time the sequence was published to when the NIH had the vaccine trial started. Now we have 3 vaccines in phase 3 trials. 2 more will start in the next probably 4 weeks. I think it's very reasonable to believe that there'll be adequate data in these trials somewhere in October, November, at latest early December, that will allow a critical review of the safety and efficacy. And I suspect that 1 or more vaccines will be approved either by an emergency authorization or approval by somewhere between November and December. We're planning very hard right now at CDC to make sure we're working with the local, state, and territorial, tribal, county health departments so that we can distribute this vaccine, working on distribution plans. And I think we're going to be able to begin to do that in the late fall of this year.
Dr. Robert Redfield, Director of the Centers for Disease Control and Prevention, thank you so much for joining us this morning and sharing this important information.
Thank you very much. God bless you.